Focus. Ideate. Innovate. Enable.
Hello and welcome to a brand new episode of Live Well with Diabetes. I'm Devina Lasson. Now through this series, we've traveled across the country to meet with medical experts to shed light on some facts about diabetes and its complications. We've learned how it affects the heart, kidneys, eyes and nerves amongst others. And today we're in Bangalore to discuss more specific yet pertinent impediments with the experts. Joining me today are Dr. Mala Dharmalingam, Professor Endocrinology, MS Ramya Medical College. We have Dr. Dwarkanath, Endocrinologist, Apollo Hospital, Bangalore, and Dr. Arun Wadhwi, Diabetologist, Apollo Hospital, Bangalore. Doctors, welcome. It's a pleasure to have you here today. Now, today we're going to discuss some very specific conditions of diabetes. We'll discuss gestational diabetes or diabetes that affects women during pregnancy. How does this affect the child in the womb, if at all? We'll discuss the difference between diabetes in children and adults. And finally, we'll discuss any myths or any precautions that people need to take when they're undergoing surgery connected to diabetes. And finally, of course, some tips on living well and living a healthy life with diabetes under these conditions. Dr. Dwarkanath, let's start with you. Can you give us an overview of what is diabetes and what are some of the risk factors?
Diabetes is not just a single disease. Basically, diabetes is a group of chronic metabolic disorders characterized by metabolic disorders of the carbohydrates, protein, fat, water, mineral, everything. It is either caused either due to insulin deficiency or insulin resistance or insulin inaction or both, affecting the metabolism of various substances, usually seen as high blood glucose levels. But of course there are other metabolic derangements and of course characterized by chronic complications, generally affecting the cardiovascular system, neural system, kidneys, eyes and all things. And this is what one makes it very important that diabetes mellitus is a disease which needs to be recognized, diagnosed, treated and look for all the complications.
Can you tell us a bit about the different types of diabetes?
Depending on the various pathological factors, there are many types of diabetes. Type 1 diabetes is there where you have a lot of deficiency. There is absolute deficiency of insulin. So generally affecting the younger individuals. Of course, nowadays we see more elders also with similar disorders. Characterized by insulin deficiency where blood glucose levels are high, ketones are there. They come with a dramatic presentation and they need to be treated with only insulin. And the predominant ones what we see in the society is type 2 diabetes. Characterized by where you have insulin resistance predominantly due to obesity, lifestyle derangements and all that. And these people generally get good control with lifestyle modifications or oral medications and they may not require insulin initially at least. And this is the group what we find in almost 80 to 90% of the patients.
Right.
Of course, there is one type of diabetes, gestational diabetes, which is usually recognized first time during the pregnancy.
Right, okay. So Dr. Mala, let's talk about one of the rarer forms, gestational diabetes. What is the likelihood to develop gestational diabetes? And if you can give us some insight into it.
Gestational diabetes is which occurs in a pregnant woman sometime around the 24th week. So it is quite a common condition in India where different studies have shown a various prevalence of about 7% to even about 20%. In Bangalore, a study was done which has shown the prevalence of gestational diabetes as 12%. The risk of diabetes is not only with the person who has the diabetes, but also for the infant or the fetus.
Yeah.
So this is something which we find very important because this in the long term has long-term effects on both the mother as well as the infant and later the baby. The other type of diabetes which happens in pregnancy is supposing a woman, young lady, would already be diabetic. She could be type 1 or she could be type 2 and then she becomes pregnant. So then in that scenario it's different because the first 3 months are very crucial for formations. So at that time, congenital malformations can happen. So it's very crucial that the person who is diabetic and then becomes pregnant also has very good control of the diabetes, as in a mother who has a typically gestational diabetes.
Okay, and Dr. Wadhvi, can you tell us what are the risk factors and what should pregnant women look out for?
The risk factors for gestational diabetes is pre-gestational weight of the mother.
Right.
If a obese lady is there who becomes pregnant, ladies who are about 25 years of age, as the age advances, the risk of getting diabetes increases. If the previous pregnancy had diabetes or any amount of glucose intolerance, if the previous baby was large baby, the mother might not have had diabetes, but she had large baby. If the mother's siblings or parents are diabetic, as the number of pregnancies increase, the number of likelihood of getting diabetes increases. If the previous pregnancy has a malformed child, baby, or unexplained death, those things are all the risk factors that the next pregnancy or the present pregnancy have a person.
Sure.
It also includes one more condition where if the waist circumference, pre-pregnancy waist circumference is more than 80 centimeters, it means they have got central obesity. And these are the people who are likely to become diabetic during pregnancy.
Right. So sort of weight control and therefore diet control, that's really key for ladies during pregnancy.
A very healthy lifestyle is very important before getting pregnant.
When we are talking about gestational diabetes, is not diabetes as defined as Dr. Dwarkanath defined it, which we say, okay, the blood glucose is so much. Like usually we say 200 or the HbA1c is more than 6.5 at diagnosis. It is a stage of impaired glucose tolerance. Okay. Even if the sugars are not in the diabetic range, but just a little deranged, that itself would go into gestational diabetes. Yeah. So we are looking at almost near normal sugars, so that there is no transfer of the glucose through the placenta to the fetus where problems happen.
So the precautions must be quite extreme, because it's a very sensitive case that can be triggered quite easily, much more than in normal cases. Is it a given then that the child in the womb will automatically get diabetes? Will it be born with diabetes in that case?
No. This is a big misconception that diabetes is transmitted. No, it is not. But the effects of diabetes or uncontrolled glucose levels will affect the fetus. As Dr. Mala pointed out, in the first 3 months or early part of pregnancy where organogenesis, organ formation is there, there if the sugar levels are not under control, there is always a high risk of congenital anomalies. It could be cardiac, it could be affecting the kidneys or the spine or so many things. Gestational diabetes as defined as that occurring later part of the will affect in a different way. A lot of metabolic derangements will occur. There is literally the mother's blood glucose levels are reflected in the fetus. Later on, baby may be born weak, leading to various problems. Then, of course, there are problems like breathing difficulties, respiratory distress, then hypoglycemia in the newborn child, which could be very dangerous. And there are other many parameters which can be controlled. So, mother's blood glucose level control goes a long way in preventing all these complications.
Let's talk about the difference in diabetes between children and adults. Do we typically see a different case of diabetes, and therefore how should it be treated and reacted to?
So diabetes, as you have heard now, there are type 1 and type 2 diabetes. In adults, predominantly, it is type 2 diabetes, but in children, they can have both. They can have type 1 also, and increasingly, because of lifestyle like we have discussed, we see type 2 also in children. So earlier, we never used to see type 2 in an 8-year-old. 8-year-old means it is type 1 diabetes. But today, because of lifestyle, children becoming obese, no physical activity, we are seeing increasing prevalences of type 2 diabetes in children. And the type 1 diabetes is because of autoimmune dysfunction. So it presents suddenly. They would suddenly have excess urination, hunger, and if you don't diagnose at that stage, they may even come comatose. They will have that ketotic breathing and they are brought comatose. Earlier they used to not diagnose at all because they never thought child will become diabetic. So that is the sudden type of presentation which happens in type 1 diabetes. But in type 2, it is the child is overweight, has a bad lifestyle, and then incidentally when you're testing for something else, you do the blood glucose, because evaluation of overweight, which is now becoming quite a important aspect even for parents, they just on routine, we just do the routine thyroid test and then we do the blood glucose and we find it's high.
Yeah.
So that is how the child with type 2 diabetes presents, which is also the way type 2 diabetes in adults present. And interestingly, 85% don't have any symptoms.
Right.
So people say, I don't test because I'm not symptomatic.
Yeah.
But that's a myth I would like to tell now, because
Sure.
if you have a family history, you need to test. You should not wait for symptoms to happen.
Is there perhaps a particular age at which you should start getting tested? Anything that might manifest that would help to recognize that it's time?
In our country, we get diabetes a decade earlier.
Right.
So compared to the Western population, which gets diabetes around 50 years, we are getting at 40 years and now increasingly much younger, as we have discussed. So supposing a person has polyps, we call it polyps, means increasing urination, increasing thirst and increasing hunger, or has a wound which does not heal, or feeling very lethargic, they should, and with a strong family history, he should test.
Okay.
He should test for diabetes, and we should not wait for the blatant symptoms to come
Around the 40 age
around the 40s.
mark. Right.
That would be good.
I would say that even younger than that,
Yes.
particularly a person is getting obese, because obesity is
Right.
increasing a lot nowadays.
Sure.
So every opportunity that any person who is about 20 years of age goes to a doctor for any reason, a person is obese, it's better to get the sugar
Yeah.
first checked.
Yeah.
Young girls coming out with polycystic
Exactly.
ovaries,
Yeah.
they're all pre-diabetic. So it's high time that we warn them at that stage.
At that stage, absolutely.
Yes.
Now, is it possible for children with diabetes to live a normal life as compared to other children? And what sort of lifestyle and dietary recommendations would you make for these children?
First of all, children with diabetes can lead a normal life. They can lead a full span of life, and not only the full span of life, a very healthy life throughout. Diabetes is a totally controllable disease, and if a well-controlled diabetic leads a perfectly healthy life. A lot of people whom we know that who are diabetic for the last 60 years, 70 years, and they are still very healthy. They are now in 80s and late 80s. So it's ample proof that a person who gets diabetes at a very young age, in childhood also, these people live a very normal and healthy life. So there's a proof evidence. Now coming to the question of what one should eat and what one should not eat. There is no specific diet for diabetes. Basically, one must eat healthy food. Now what is a healthy food? Particularly for a diabetic, any food that does not increase the blood sugar immediately after taking it.
Okay.
So
Yeah.
it's preferable that a person avoids direct sugars or sweet juices and very much anything sweetened food.
Okay.
Or mithai and all
Artificially
those things.
sweetened.
Yes, artificially sweetened is okay, but anything that contains sugar, the regular
Yep.
plate of meal should have a carbohydrate, what a normal person eats. A Punjabi eats a roti and a Keralite eats a rice. Both of them can enjoy their own dish, whatever they want to eat, but preferably if they take lot of food, vegetables, which will not increase the blood sugar immediately after taking roti or rice or
Yep.
something. If the whole grain food is taken, which is not polished, definitely the blood sugar does not increase after food. This is a healthy recommendation even for non-diabetics. Apart from that, one should avoid taking too much of fatty food. The whole fat milk, if that is being taken, or extra fat is being used. People who take non-veg should avoid red meat and take white meat,
Sure.
something like fish and chicken. That is preferably allowed. Not only the quantity or the food of important, exactly in a child, what is equally important is the timing and the type of food.
Right.
The type of food I have explained. The timing is very
Timing,
important because it has to
frequency.
match the medicines.
Yeah.
So 3 large meals and 3 small snacks
Yeah.
are generally advised.
There's something called glycemic variability. Sugar goes up and down, up and down. So if you're keeping on changing your diet, so it will always go up and down.
Yeah.
So that should be sort of stable.
Yeah. Speaking about the medications that children have to take, what is the typical process of the medications for children with diabetes? How long does it last? I presume it's not a lifelong, as Dr. Arun said, of people with diabetes at a young age grew up to be very healthy and live long and healthy lives. But tell us about the medication process and the duration of it.
Consider that at least at present, predominantly it will be type 1 diabetes.
Yeah.
So it is important that we educate the child as well as the parents about the need for insulin. These people cannot stop insulin. They have to continue insulin depending on their blood glucose level, depending on the situation. The changes will have to be made, monitoring and all that.
Okay.
We have a small group which is actually increasing, type 2 diabetes in the young.
Yeah.
There we can start with the proper lifestyle modification. So proper education regarding diet, which promotes weight loss, exercise, whether it is in your daily routine or separate exercise and all that. And even them monitoring the glucose levels, monitoring other biochemical parameters, see that they are within the normal range. If required, if the diet, exercise alone is not sufficient, medications can be used. Even in this type of patients, of course, as they grow up, as the duration of diabetes increases, tablets may not work. They may require insulin for glucose control. Okay. These are not dependent on insulin. They need insulin for good control. Right. Whereas type 1 diabetes, as I said, predominantly younger individuals, they are dependent on insulin. So they can't afford to lose. In fact, if they are sick, if they are not well, they may require more insulin, they may require more monitoring.
Something which is very important that I want everyone to understand is that there has to be a change in the family itself. Yeah. You can't have a diabetic and say, okay, you eat this diet, we all eat something else. You can't do that. We also teach children something which is called caloric counting. Okay. So in case it's his birthday and he wants to have a chocolate cake, he can actually count the calories and on that particular day take a few extra shots of insulin and take his cake, because we can't deny childhood to a child.
Dr. Mala, let's also talk a little bit about surgeries that are connected to diabetes and diabetic patients. Can you tell us what are some of the precautions that patients must be wary of and must take care of when they are about to have a planned surgery connected to diabetes?
When he requires surgery, he should see that his blood, especially a planned surgery, his blood glucose should be very well controlled. So sometimes what happens, people only see their fasting PPBS, oh my sugar is controlled today. That is really not good enough. Yeah. If it is an emergency surgery, possibly yes, but they should see their average sugar over the last 3 months. This is surgery for a patient who is having a problem and going. Right. The other surgery that a person all are interested in is bariatric surgery or metabolic surgery. Yeah. So what can I undergo? There are guidelines as to the weight, the morbidity, what are my complications, and then if you are fit into that, then you can go for metabolic surgery or the bariatric surgery, and it would help.
And doctor, surely there will be some post-surgery care that patients must look out for.
A diabetic remains a diabetic before surgery and after surgery. So whatever care he has been taking before surgery, so that surgery goes well without any event, he has to take care after the surgery as well. Yeah. Having said that, all surgeries are not same. There are some short surgeries like eye surgery and other things. Right. There are simple surgeries, patient doesn't have to stay in the hospital for a long time. After the surgery, he must continue to maintain the strict control on his food habits so that the wound heals better. Right. That's important. He must continue to do his physical activities as earlier. Limb surgeries, leg surgeries and other things, the movements become less. If sitting exercises, he must continue. Okay. There are some surgeries which are done on intestines, which will avoid a person to eat food. Normal food cannot be taken. At that point of time, of course, an expert advice has to be taken. But the moment the wound has healed well and the person has come back to his feet and come to normal life, he must get back to the normal food habits. The earlier he starts, the wound healing and recuperation becomes faster.
Doctor, thank you so much. That's been really enlightening. Before we go away, if you can all give us just one tip or a few tips to living well with diabetes.
I would suggest that possibly a person should also look at his mental state and not be thinking that, oh, I'm diabetic and my life will change. Yeah. It will not change. It will become much more healthier, and possibly he will live without any problems if he takes care of himself.
When you are diagnosed, don't be depressed. There are ways of controlling the sugar. There are ways in which you can lead an absolutely normal life, achieve everything. In younger individuals, they may get into depression and they can't do anything. No, you can do anything. Type 1 diabetic also can achieve whatever he or she wants to do.
Make efforts to at least do 30 minutes of physical activity. Right. Come what may, can climb stairs if you don't have time to go for a walk. At least climb stairs in your office. 1 point, 30 minutes of exercise. Second is, every time you eat food, see that vegetables are there. You don't become a vegetarian by avoiding mutton and chicken. You become a vegetarian by eating vegetables. This point has to be maintained.
Right.
So everybody must eat a lot of vegetables.
Great, fantastic. Doctors, thank you so much, all of you, for joining us today.
Thank you.
Thank you.
Thank you.
Thank you so much.
Well, that's all we have for you on this episode of Live Well with Diabetes. But stay tuned to the channel as we continue to travel across the country to meet with medical experts to answer all the questions you may have about staying healthy with diabetes. Until then, from the entire team, many thanks for watching.
Focus. Ideate. Innovate. Enable.